For years, we have asked the same question: what is the best AI for medical questions? And the true answer is we don't really know. Why? Because the market is always evolving, and one model tends to always outperform others, or there could be a specific model that is performing really well for a specific specialty. So what we have come up is in DeepCura is something called Clinical Battle Royale. And what we do is DeepCura becomes the arena, the coliseum, where we put all the 4 top major models in the market battle each other. And we give them the same specific tools. Unlike opening ChatGPT, Claude, and Gemini and Grok in 4 different tabs, what we do is we give them access programmatically to the same APIs and the same tools on the same US government databases with the best data, right? Such as the FDA labels, the top journals in the market available via PubMed, and so that they use these tools in a specific way, and you can see their tree of thought and reasoning and the tools they use. And then when they come up with their own conclusion, they all blind judge each other. And then we assign to each conclusion a score based on the analysis, and the models itself, they choose the winner. So there are 2 passes, right? The first pass is the one you see here, where you see the bottom line of each model, the reasoning, and also the tools that they were called. You can also see here the divergences in like what the models agree on and what they disagree, right? And once they're done, you can see they start battling each other with their hypotheses, right? And once this process is done, you can see the winner, and then you become in some way the final boss. You become the final judge, and you get to agree or disagree with the divergences, the hypotheses, and you get to understand specific sources they use, right? So here you can see every model came up with their own conclusion. You can inspect the specific journals they use, and finally you get to understand why the winner is the winner in a few moments. So let's just wait here a few moments and we should be all set. And we believe this more transparent approach rather than trusting a black box, because you don't know what is in the black box, right? They tell you the black box is the best, but you don't really get to know. At least here in DeepCura, we give you the whole transparency, and here you can see the battles, right? We have here 6 different battles, and you can see exactly why each model thinks which hypothesis is best and the reason why, right? And you get to explore the clinical breadcrumbs across each source, right? So that is how it works. Feel free to try it and let us know your thoughts. It also auto heals the more you interact with it. The same judges will improve and optimize the engine. We believe this is the best approach when it comes to answering medical questions. Why? Because it is just the most transparent. Because we don't know, like maybe tomorrow will come GPT-7 or Claude 9, right? And we don't know which model will be the best. And sure, you can see a study, right, that they will benchmark the models maybe this month. But what happens when the new model comes out, right? They have to make a new benchmark. So this is just a never-ending, evolving situation where a tool like this, Clinical Battle Royale, will become really relevant because you get to do the benchmark in real time, and you get the benefit of seeing which is the best 3, and the AI models themselves, they choose the best answer based on their own reasoning, right? So thank you for watching this video, and I hope you enjoyed this new product.